The information in this video is for educational purposes only. It is not intended to diagnose or treat any specific medical condition. Use of this information is not a substitute for advice from your physician or therapist.
Now, there are other things besides exercise that impact our muscle balance. Posture is one of them, and I discussed good posture in my posture video. Now, another thing that can impact our muscle balance is how we sleep. Now, if you need a pillow, make sure you get a comfortable pillow, and you get one that can fit comfortably in the corner between your shoulder and your neck, so your head can lay down on it, and therefore your neck can be straight. Then you either lay on your back or your side with a cushion between your knees. This helps keep your spine level, helping to improve muscle balance. Stomach sleeping can definitely encourage muscle imbalance, primarily because we turn our head one way or to the other, keeping our neck a little bit tight. If you want to train yourself away from stomach sleeping, then I recommend wearing a t-shirt and sewing a ball on the front of it, so it's right over your chest bone. You could use a simple practice golf ball. Now, every time that you roll on your stomach, it'll probably waken you a little bit, reminding you to lay on your side or on your back. After a couple of weeks, your body will get used to not laying on your stomach. When it comes to pillows and beds, there aren't any firm recommendations. I mean, these are pieces of furniture that the furniture designers have slapped labels on that says that they are health products for your back. So you want to get a pillow and bed that's just comfortable for you, and you may have to experiment with them. There are these products now that you can return them after 100 days. So I think that's really good. So you just have to experiment. You want to make sure they're not broken, that you're not sagging, but there's not a precise one that's actually I can recommend. And also remember that the value in how you're sleeping is 1/3 of your day. So you want to make sure that's comfortable and that your spine is aligned the way I described earlier. But also remember that 2/3 of your day is standing and sitting. And so if you're having a lot of muscle imbalances during those 2/3 of the day, maybe the 1/3 of the day that you're sleeping isn't as important as improving the muscle balance of the 2/3 of your day when you're standing up all the time. And maybe if you do the exercises and improve your muscle balance in the 2/3 of the day when you're awake, maybe the bed and the pillow become a non-issue. So what about the 2/3 of the day that you're awake? What things are impacting your muscle balance? Well, one of them could be the bag you're carrying. If you carry it over your shoulder like this, you might unconsciously hold your shoulder up like this. I see this a lot in my patients when they're walking out the door. I have to remind them that when they put their strap over their shoulder, they're holding their shoulder tight because they don't want to fall off, which makes sense. But this could be a persistent reason for the neck pain and discomfort they have, not the pillow they're sleeping on. So I like this bag because it's a backpack. So you could put it on over both shoulders, relax your shoulders. Or you can get a bag that has a strap that you put over one side, hang on the other. Create some muscle balance. Now guys, what about the wallet in the back of your pocket? Take it out of your back pocket, put it in your front pocket, put it in your jacket, put it in a cargo pocket. Never put it in your back pocket again. When you sit on your wallet, you shift your hips, encouraging muscle imbalance in your low back. Lastly is how we sit at our desks and our computers. It's called ergonomics. Office ergonomics, computer ergonomics, desk ergonomics. Now a lot of people are turning to standing desks. And I am a fan of standing desks. I think standing is always better than sitting. But again, it's not a cure-all, just like changing your mattress or your pillow is not a cure-all. Because if you're standing all day, but you still have muscle imbalances because you're not doing the right exercises, then you're still standing with muscle imbalances and you may still have discomfort and pain. So what lifestyle activities are you doing that could be encouraging muscle imbalance?